Hello, I'm Dr. Ghaffari. I am one of the early pioneers developing IPL technology, and I work extensively with people such as Dr. Patrick Bitter Sr. in developing photofacials, as well as a number of applications that was for skin treatments, including pigmented lesions, vascular lesions, hair removal, and skin rejuvenations. I'm the president of Venus Medical Solutions, and as I look back about 20 years ago, late in 1990s, I did the video training discussing the scientific and clinical applications of IPL technology that I think you will find interesting. I encourage you to see them, and there are different segments that talk about different aspects of the technology, and I hope you would enjoy them. Now that we want to talk about the theories of what's going on and lead into the practical applications of using the device and the sapphire cooling, what I'd like to do is to bring in new concepts that cools the skin effectively better than what it has been in the past. The ideas basically come from the factor that we have epidermis, which is much more absorptive to light than dermis is, up to about 3.5 times. And also we have different types of skin with different concentration of melanin, which causes different absorption to light. So the problem is not a one-dimensional problem, but what is important to keep into consideration is that the temperature of epidermis jumps up 3.5 times faster. So the epidermis gets very, very hot. What we have developed is this sapphire that has a small sensor on it that measures the temperature of the sapphire and the skin directly. And the sapphire is being cooled by cryogen. And this sapphire is attached to the handpiece, to the crystals, by inserting the crystal into the sapphire handpiece. The sapphire material comes in contact with the skin directly. There is a sensor which measures the temperature and feeds to the computer system about what is temperature at any given time. And the computer regulates and controls the flow of the cryogen into this jacket, which will maintain the temperature very precisely within 1 degree Celsius. So the question is, why do we choose sapphire as the material to contact the skin? Typical gel that was put here between the crystal and the skin has a thermal conductivity of 1. Sapphire has thermal conductivity of 25. Consequently, the sapphire material can remove heat 25 times faster than gel can remove heat. The second problem, that besides the fact that gel has low thermal conductivity, the second problem we have been encountering using IPL devices in the past is that if the crystal itself came in contact with the skin, the crystal was at warm temperature and it was not being regulated, the crystal would not have enough heat removal capability at high temperatures. And as a result, you would cause blistering and side effects. As a result, it was recommended to put a very thick layer of gel on the skin and float the crystal in the past. But flotation causes you to not knowing exactly where you are from the skin, and as light comes out of the crystal, it has a divergence characteristics. As a result, the further away you pull the crystal, the more losses, and as a result, your treatment would be compromised. Now, on the curved surfaces, the crystal could only touch in the center, and you would get more irradiation at the center than you would on the sides, which we've resolved that by being able to gently lay the sapphire on the skin directly. And the temperature of gel, because you were using cold gel to begin with, it will vary over time as you start doing treatments, because the previous pulses would have all the heat which will carry over to the new places to be treated. As a result, we've resolved all of those by creating a sapphire contact cooling, which will basically be attached to your crystal. So by placing the crystal inside the adapter and plugging it into the existing head, now we have IPLs that have sapphire in contact with the skin, crystal that can do filtering of light, and with the application of a small gel on the skin, it can come in contact with the skin. We have developed this technology so that now you're able to reduce down the delay times as little as 1 millisecond in most cases, to be able to become very aggressive towards certain type of vessels. So as a result, the structure here, we generate light in the head, pass the light through the crystal. We put a little bit of boundary between crystal and the sapphire. We put gel here, and we also put gel around the crystal in order to seal the crystal and make sure that there is no leakage of cryogen, so that it will give you the maximum cooling ability of the handpiece. And we'll show you exactly how to do all of this in the practical portion of this training. Having said that, we put a little bit of gel between the sapphire and the skin, because the skin is usually dry. You need to have an interface that it can pull out the heat. And index of refraction of all these components would become similar to each other once we have a gel interface here at an index of 1.5. So light can easily go through, and the back scattering of light is reflected back, and you have certain level of recycling, photon recycling that's going on. Okay, now as a recap of all the things that's going on, what we have done is take into consideration the temperature of the skin by maintaining a temperature of sapphire that comes in contact with the skin, by taking out the distance variability between the delivery of light and the skin. We have taken another big factor out of the equation, so the results are becoming more and more consistent. Now that we have developed all of this, we looked around at all the different settings that were recommended by a number of physicians across the United States and the different regions of the world. We found out that there is no science behind it, meaning that they were all over the map in such fashion that it did not make scientific sense. So what we developed was the manual, which has different components to it. But this manual is the first guide that basically teaches you how to dial in, taking into consideration these different skin types and all the parameters you need in order to get effective results. This is the photofacial manual, and the sessions are 5 sessions. Each session you start out from top layer of skin, and you try to even out the pigmentation, get rid of vascular lesions, and go down for collagen remodeling. So let me talk a little bit about collagen remodeling. Collagen remodeling is the way of creating heat in dermis such that the heat causes an elevation and some of the regeneration of the collagen within skin. As we know, we lose about 1% collagen per year, and if you look at 1% per year, towards as we get older and older, almost in an exponential fashion, our skin looks older and older. Collagen is what has been basically lost with age, and most of the other topicals, whether it's in terms of peels or any other topical that we have used in the past to make a skin look younger, they all have caused rapid deterioration of the skin and loss of collagen. This is the first technology that really is designed to build the heat necessary to build up collagen. And also, light therapy is so effective because if there are pockets of areas within dermis that the collagen is not fully in place, or all the fibers are not aligned properly, they usually trap more heat and cause more collagen growth than some other areas. So the three components that we look at in doing photofacials is pigmentation, looking at pigmented lesions, vascularization, looking at vessels, and collagen remodeling. The set of settings that we have here, we have broken it down into 5 sessions. This is a representation of one session. The page includes treatment number, which is session number 1, vertical radiation. On the subsequent pages you will see horizontal irradiation. So let's talk about what is vertical and horizontal irradiation. If someone is standing upright, vertical irradiation means that you will be holding the crystal and rotating about a vertical axis. Horizontal irradiation is when you rotate this crystal as you're doing the treatments about a horizontal axis. Why is it important to do this? What we have found is people who've been doing it for years, after so many years, they start doing the same thing over and over on face. So typically they place the crystal and they do treatments, and constantly they miss certain areas of the skin. Going with horizontal and vertical irradiation, it forces the operator to change the methodology such that you cover the entire area in certain treatments like this, in certain treatments like this. So you're crisscrossing the treatment area. So that's the definition of vertical and horizontal radiation.